A big round of applause for the ladies. Well, I plan to take you forward in this journey by briefly telling you about, introducing about what is a medical value travel facilitator. A big brief about what is the global landscape, what is the Indian landscape, and subsequently go on to what do the travelers require, and what do the facilitators should do to facilitate that travel, and what are these standards we are talking about, and why it is so much important to have knowledge about these standards and become a part of empanelment for these standards. So I'll go forward accordingly. We all have seen what is NABH and what is Quality Council of India. Quality Council of India actually is creating an ecosystem of quality in our country, and we are grateful to QCI for that. And QCI came into being with the combined efforts of SOChem, CII and FICCI. So again, thank you FICCI for being there always to improve quality. And when we talk of quality, quality is nothing but degree of adherence to pre-established standards based upon current knowledge, practices and principles. So we'll discuss quality in these three parameters. Now, what is medical value travel? People are traveling. That means somebody is traveling outside their own country of residence. For what? For taking care of their medical needs, and those needs can be preventive, promotive, curative or rehabilitative. And to all these needs we need to add value. And value is of value only if that value is valued. And to value that value means it should be cost effective. That is the first this thing of denominator of value is it cost efficient, is it cost effective? Yes, you travel for the purpose of maintaining, improving and restoring health through medical intervention. Treatments must span the full range of medical services, I told you, right from preventive to rehabilitative. Now, a lot of processes are there, and today we discuss them, what all you can travel for and how India can, start medical tourism to a much higher level. We travel for modern medical treatment. We also travel for traditional medical intervention, and we also travel for wellness and rejuvenation. If you see the global landscape, it has already been discussed at around 10.7. Some people say it is going at a compounded annual growth rate of 11.04%. Whatever the case, maybe it is between 10 to 15%. We have these high top 10 destinations: Thailand, Mexico, US, Singapore, India, Brazil, Turkey and Taiwan. Global medical value travel market size estimated to be between US 60 to 80 billion dollars, and some 14 million people travel across the borders for medical tourism. Now let's see the India advantage. We were amongst the top three. We are probably today morning I learned we are 10th, because that's what the minister said. We are 10th. More than 6 lakhs medical tourists visit India per annum. We have introduced e-medical and e-Ayush visa. We have launched a market development assistance scheme for medical wellness tourism providers. There are diverse traditional techniques that are available with us for taking care of the medical tourists. We have highly trained personnel, skilled staff who are amongst the world's best. We have state-of-the-art and accredited facilities. We have got NABH, JCI accredited hospitals who can take care. And of course, what is most important is affordable costs. And when you see the partial slide on my right and your left, you will see the figures. A dental implant costs in US $2,800, in other countries as high as $4,200, in India $1,000. A heart bypass surgery, it costs as little as $5,200, the lowest in its spectrum across the globe. A heart valve replacement will cost around $5,500 when you compare to people costing $1,70,000 in US. When you go across anything, hip replacement, knee replacement, we are the cost affordable option. And this is how we must move forward, that we are cost affordable. Are we effective? Yes, we are effective because we provide medical care in state-of-the-art accredited facilities which are benchmarked globally with the best. So how does medical value travel facilitation help? For anybody coming to any country, the destination is unfamiliar. The language quite often unfamiliar. Am I getting the price? I am paying the price what I should be paying. So guaranteeing the cost of procedure or negotiating the price, that is how your medical value travel facilitation helps. It helps you with insurance claims. It should help you with your personal assistant during treatment and recovery. And of course, it also helps you with your accommodation, your transportation, your travel costs, your visas, choosing facilities and doctors, and taking care of any unexpected events that may take place during travel, during medical care or personal health and well-being. So this is how medical value travel facilitation is supposed to help. It requires, of course, cultural competence because it requires, in addition, language services, somebody to interpret in the local language, and India has got diversity of languages, so there may be a whole lot of interpreters that you require. You require cultural sensitivity in delivery care and personalized care pathways for all international patients. Of course, we also do require technology and digital solutions. That is the way forward. You can have teleconsultation and use of telemedicine for coordination before starting of the travel from the parent country to our country. You can also use teleconsultation for post-treatment management and post-treatment rehabilitation, consultation and advice. Then you must have an electronic health record which can be built into your systems with ensuring that there is blockchain for data security. Security should be accessible to only those, data should be accessible only to those who are actually concerned with treatment and whose treatment is being planned. There are certain future trends. We do not know where we are going to go with these trends, like artificial intelligence and predictive analysis in healthcare regulation, sustainability and ethical travels, and emerging destinations and policy innovations which will take place as a consequence of this workshop. The key stakeholders are the ministries of tourism, health and family welfare, Ayush, commerce, state governments, the healthcare industry, industry associates like FICCI and CII, the MVT facilitator, the commercial partners, the hotels, the airlines, and of course the NABH. Now, what do patients look for while choosing a medical value facilitator? Previous experience, of course, that is always an added advantage, especially for the same medical condition. Somebody has a personal contact, interpersonal relationships, their phone, WhatsApp, Zoom, emails, then understanding whether you have understood my exact medical need or not. Any past patients, their testimonials, hospitals and providers on panel, any additional services in terms of travel, accommodation for relatives, for themselves, and are you providing end-to-end solutions? There are things which a traveler is looking for adding value to his medical travel. One more question they are likely to ask in the future. They already started asking. Is the medical value travel facilitator accredited, empaneled or certified by any agency? This is going to happen sooner than later, because not only am I going to an accredited facility, is the person providing me care is certified, can I trust? So this is going to be the next step, and towards that NABH had come out in 2016 with a medical value travel facilitator empanelment program. So they had started this first edition in October 2016. It was revised in 2024 and I think put into effect from 1st April 2025. Aim is to provide a step-by-step staged approach to quality improvement as per global best practices, and it is based on the principles of Heal in India and Heal by India. The objective was to provide guidance to medical value travel facilitators for providing optimum services to the offshore travelers traveling to India in search of quality medical care, and to facilitate deliverance of high quality care to international patients. Also to emphasize on business, patient safety and staff safety as per the best global practices through process of self and external evaluation, so that you are accountable and you are found to be reliable. And these standards have been laid down keeping in view the Indian ethos and working environment with global healthcare approach in mind. So we have thought global, but we have acted local. These additions focus on the agency involved, whether it is a travel facilitator or the hospital itself is working as an agency in managing and coordinating all the activities related to core of the patients and their treatments while traveling abroad. There are 7 sections with 43 objective elements that are designed to encourage continuous improvement efforts within the organization while adhering to the empanelment criteria. And of course, it is granted on your own self-assessment based upon an on-site visit, which could be also virtual, by a team of peer reviewers, typically conducted every 2 years. So once you get empaneled, it is valid for 2 years, and the standards facilitate delivery of high quality of care to international patients. These are the 7 sections. The first section is based upon general information to access, that is there are 10 objective elements in this. The second one is for patient assistance, that is there are 9 objective elements. And next is responsibilities of management, human resources management, your financial management systems, your quality improvement, and your information management systems. These are the various standards and objective elements. You will see that the most important ones are your medical facilitator quality improvement programs and your information, general information on how a patient access to you, as well as your patient assistance. There are certain compliances with which the medical value facilitator has to be compliant with. The first one is to get an import-export code, which is allotted by the Director General of Foreign Trade. The second one is to get a registration cum membership certificate by Export Promotion Councils or Commodity Board or Development Authority or any other competent authority. You have to be registered as a company with a PAN and a TAN and a GST certification, and of course a fire NOC or a third party fire audit if you have a physical facility with you. For ensuring quality and patient safety, as I told you, there is a separate standard on medical travel quality improvement program which contains 9 objective elements which are related to patient safety goals that have to be complied with necessarily, irrespective of the compliance with other elements. It has mechanism in place for doing your own competency assessment, your compliance audits, and your internal assessments. There are feedback loops in terms of feedback that you receive, and those feedbacks have been put into action by the medical value facilitator, and also ascertaining the patient satisfaction indexes. There are certain key performance indicators which will help to recognize whether progressive efforts are in place in the implementation of these standards. Some of them I have listed here. Average processing time per patient are supposed to be done monthly. Percentage of the patients in whom follow-ups are maintained once in a year. Employee satisfaction index twice in a year. Patient satisfaction index monthly, and number of patient complaints monthly. So these are some of the key performance indicators based upon which we know that you are improving yourself and finding out ways and means to correct in case there are some deficiencies in the services. So to conclude, NABH Value Travel Program plays a crucial role in enhancing India's position as a preferred healthcare destination by ensuring quality, safety, and patient-centric care. You know, NABH follows the adage of STEEP, where S stands for safety, T stands for timeliness of provisioning of services, E stands for efficiency, other E stands for effectiveness, the third E is for equity, irrespective of nationality, religion, and color of skin. Same care will be given for the same type of medical ailment. And last is P, that is patient-centric. We try to align with the global standards so that NABH education strengthens India's credibility in the field of medical tourism. Through structured guidelines, patient safety protocols, and robust accreditation processes, the NABH MVT program fosters trust and transparency. So what you are looking for, credibility, trust and transparency, this empowerment guarantees you all this. It not only benefits international patients seeking affordable, world-class treatment, but also enhances India's healthcare infrastructure and international collaborations. Moving forward, continuous improvements in digital healthcare integration, seamless patient experience, and adherence to international best practices will further boost India's reputation as a leading hub for medical value travel. I have no doubt that India will be the leader once in times to come in terms of medical tourism, because we have everything with us. It will not only foster additional employability, but it will also significantly contribute to the GDP of our country. Thank you for your patient hearing. Jai Hind.
One question is there.
Any question afterwards or not? All right. Yeah, please.
This is for Ayush also. This NABH MC.
Yeah.
This is for Ayush also.
This is it?
Ayush.
Yeah, this is for Ayush also. This is common for everyone.
Okay.
Because it does not mention whether the healthcare facility is going to be, because NABH, if you've seen, has also got Ayush standard for Ayush hospitals. So if you want to see whether Ayush hospitals are accredited, the medical value travel can say that those hospitals are also accredited. Okay, so it is common for both Ayush as well as for other healthcare facilities, modern healthcare facilities.
Sir, this diagnostic centers, are they required to register with NABH or NABL?
Okay, it is NABH.
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 Okay, fine, good. Now, more than 60% diagnostic centers in India are unorganized. This is on record.
Yeah. And that is why we want that everybody should come into, I agree with you, everybody should come on board. Now these diagnostic centers have to come on board, and that is why NABH is trying to reach out now. We are doing what we call Gunatava Yatra. In this Yatra, NABH people are now going to tier 1, tier 2 cities, meeting with people, generating awareness, trying them to come and bring them into the system. So what you said is correct. Many of these centers are still not come into the system. We are trying to find ways and means by which we bring them into the system.
Enforcement of law. Very important.
Okay. You know,
Thank you.
India is a democratic country, and democracy means लोगों के द्वारा लोगों की ऐसी की तैसी. Okay. So it is for us whether you want ऐसी की तैसी or you want to actually come up to that level. Yeah, please.
So
one by one, please. Yeah.
Sir, you said diagnostic will be by NABH. NABH or is it NABL?
Okay, with diagnostic centers or what? See, if they are labs, it is NABL. If it are hospitals, it is NABH. If it is medical value travel facilitator, it is NABH.
Even NABL also option.
Imaging services is NABH.
So the patient will be looking at diagnostics only. He is not bothered whether it is lab or this thing. Why don't we have only one organization for quality?
The Organization of Quality is Quality Council of India, and that Quality Council has got separate boards, where the National Accreditation Board for calibration and testing of laboratories, that comes under QCI only. So overarching organization umbrella is QCI.
So my question was, when you're talking
I'm so sorry to intervene, sir, since we are already
No, just
short
finish.
of time.
I just finished.
Let us give him the last opportunity.
I just finished. I said when we are talking about medical value, people coming to Delhi, people going to Chennai, the rates are different in the hospitals.
I'm not able to hear.
So the
He has question related to the cost.
the cost is so. When you in your presentation, say you mentioned 1,500 or 1,100 for a dental implant in say India and where.
Yeah, okay, yeah. That's just an example.
Yeah.
That's just an example, just to give the India advantage and make people more knowledgeable about this. Yes, I agree with you. Rates in different hospitals are different, and we cannot, because based upon the facilities that the hospital provide, based upon their own expenditure, the budgeting is slightly different. Okay.
Thank you.
Okay, thank you very much for your time and